Okay, welcome everybody. Last one, packed house. All right. So I'm going to move through here rather quickly. There are lots of things I want to spout off on, but I feel like I don't have time for this. So, uh I will not. We have talked about a few of these in a little detail already. So, every time I start this chapter and see this first image without looking at the words, the first thing that pops into my mind is malaria because I see a big fat mosquito full of blood, and that's what I think about. That's not what we're looking at here, although we could be. So yellow fever, this is a viral hemorrhagic, so blood viral infection. There are numerous things that happen with this. Liver damage resulting in jaundice, as we've seen that before. One detail with this, Aedes aegypti is the mosquito that's transmitting yellow fever. This is not the mosquito that transmits malaria. So can't be malaria in this image because it's the wrong vector. So we'll talk a little malaria later. So circulatory system, initially, as we look at this coursing through our body, a great mechanism for transport of pathogens. There's all sorts of stuff thinking what it really should be doing, but pathogens, this is a nice superhighway to bring things as we think about organisms potentially becoming systemic or things truly targeting within the circulatory system in the first place. I'm not going to go through all of the anatomy. The lymphatic system, a one-way, one-directional flow, draining fluid from our tissues and ultimately bringing it back into the circulatory system. Numerous lymph nodes that serve as kind of collection, little eddies, little pools where microbes have opportunities to have greater recognition by immune cells. And we also can potentially see some inflammation. The buboes that we've seen a few details with already when the lymph nodes are truly dealing with some of that. So this just showing the mechanism of the lymphatics draining fluids and the circulatory system, closed circulatory system, as we see the blood moving through into the capillary beds and then returning in the veins for the cycle to continue. The spleen is part of the lymphatic system. It has numerous roles. We think about old or aging red cells going into the spleen. It has the potential to serve as kind of a reservoir for some blood if you happen to be exhibiting some serious blood loss. The spleen, kind of like a sponge, will squish out those cells, trying to give you some extra cells. But typically, that's where they go to get recycled, if you will. Other things as we think about with the spleen, with the lymphatic system, numerous potentials for cells to gain recognition, similar like lymph nodes with these cells within there. There are other details or issues as you make it to adulthood, mid-20s, having your spleen removed doesn't really cause any sort of serious issues. If you are a little kid and that happens, that's a different story as a result of all of these immune cells and their proliferation initially. So here we're looking at some vegetations, bacterial vegetations, bacterial endocarditis on the mitral valve. And you can see what are these? The heartstrings, chordate tendonae. Do you have it on the test? Oh, okay. It was on there. You're like, I know those. Okay. So we talked a little bit of Clostridium and gangrene. Gas gangrene is what we're looking at in this image, and I'm assuming same person as we're looking at this X-ray. The gas is the result of this anaerobic organism as it is in there fermenting and producing copious amounts of gas. You can see separation in between the muscle layers. That's the gas gangrene. And we are rather early into this. We aren't yet seeing necrotic tissue, but we're on the verge of that emerging if we don't get it dealt with quickly. This image is Francisella tularensis. Tularemia is a very contagious bacterial infection. This lesion on this individual's hand doesn't look like it's that big of a deal, but it is. And as this organism gets into the circulatory system, it can be a fatal infection as a result of that. It is a bacterium that is high on the list of potential bio warfare agents. Bad news. This is a bacterium that is pretty common in the environment. It's found in rabbits, and oftentimes we see instances with infection with individuals that go out and hunt rabbits, skinning them, potentially like contracting anthrax as you're shearing sheep or something like that. There are similar opportunities to get inoculated with Francisella. There have been other opportunities to get infected by not hunting rabbits, but accidentally mowing over a dead rabbit and aerosolizing that organism sets the stage for some of these issues. Few years back, up at the hospital, they had an instance with this. I believe it was an individual from around Soda. He was mowing the side of the road, all of the thick grass and stuff. So I'm assuming maybe big tractor sort of deal or a riding mower, something that set the stage for this to get aerosolized. This is something I mean, it's potentially common, but not something we truly think about seeing all of the time in the clinic. So the med techs dealing with patient samples, doing the microbiology, were pretty shocked to see this. They also all ended up needing a course of antibiotics because the potential for infection is humongous. None of them became infected, probably because they started therapy immediately. All right. That patient remained quarantined in the hospital for a couple of weeks, recovered, all fine and good. All right. Pretty crazy. The plague, so many stories. Every time I think plague, all I can think of is Monty Python's Holy Grail and Bring Out Your Dead, right? That's what I think about. That paints a beautiful picture of it. So this bacterium is something that's plagued humanity since it seems like for forever. There's all sorts of accounts, and it's something that still happens. We can see cases, although very rare, cases in Idaho. Oftentimes now we think more of, at least around here, potentially the sylvatic rodent flea type of cycle. Squirrels maybe serving as good vectors, reservoirs, I should say. Our vector is the flea. Reservoirs for harboring it and opening up potentials for that to come to us. Fleas are the vector that serve as the transmitter from one of these animals, potentially to us. Really kind of interesting, kind of disturbing. The bacteria gets into the flea as it's taking a blood meal, and as it gets into the midgut of the flea, it basically causes blockages. So the flea is full of bacteria, can't digest any food, and in turn wants to constantly feed. So as it hops from host to host, trying to take a blood meal and feed itself because it's starving, it ends up regurgitating the bacteria and transmitting it that way. So dies with a full belly, starving to death. Kind of crazy. And a brilliant strategy, if bacteria have strategies, which I feel like they must, a brilliant strategy for that bacterium to be transferred from host to host, lending to plagues, right? So all sorts of other opportunities. And with the plague, there are numerous things that we can think about: septicemic, bubonic, and pneumonic plague, different presentations. Pneumonic plague, bad news. And the prognosis with that is very poor. So buboes, as we see here, those swollen nodes, often characteristic when we think about Yersinia pestis. And now within the lymphatics, we can also see in this next image the septicemic results, possibly, as we move into the circulation and start moving throughout the body. Extremities, toes, often are the first things that we really start seeing with the necrotic tissue, where it gets into the capillary beds. And I feel like it's similar to what's happening in the gut of the flea, and circulation is basically cut off. And there you go. So here we could see our pestis. These guys are interesting, and I think gram staining, if you were to see this, there'd be numerous things that might pop into your mind initially before you start thinking plague, but it also depends on how that patient is presenting. That might clue you in that we're thinking plague in the first place. But when I first look at this and I see the dark bits at the end and the sort of hollow looking thing on the inside, my first thing that pops into my mind is maybe I'm looking at some spore forming bacterium, because oftentimes a spore forming bacteria, when it's stained up, if it's in the process of that, you see this image that sort of looks like that. An endospore stain would rule that out, and these would not stain up green like they should if it was a true spore. So they kind of call this a bipolar staining, where the ends are what's stained on these gram-positive rods. They also have sort of a safety pin sort of appearance, kind of looks like little safety pins, that's characteristic of pestis. And deep down, looking at, this one looks sort of rounded, but this definitely doesn't. That's not as spore looking to me as maybe this guy. This is a blood smear, blood stain with right stain. So we're not looking at a gram stain, but they still kind of look gram positive based off of those right stain reagents. So as we see this, there's numerous other white cells, and stacked up all together a bunch of red blood cells that look sort of brownish. Moving to some tick-borne stuff, Rocky Mountain spotted fever, prevalent more sort of East Coast, spanning into the Midwest as we look at some of this. Rocky Mountain, because really a lot of the research initially done with this parasite happened in the Rocky Mountains, right up here at the NIH lab in the nose of Montana. In Hamilton, Montana is where a lot of the research with this has happened and still is happening, along with others that we will look at as we progress along. So here we can see the rash characteristic of our spotted fever, our Rocky Mountain spotted fever. It's different from epidemic or marine typhus. We'll hit these guys in a second, with lice and fleas transmitting this as opposed to our ticks. So starting on the hands and wrists, moving to the trunk, the others are the opposite. Little bits that may clue you in. Lyme disease, another tick-borne parasite, not the same, but kind of similar to our relapsing. This, I think, is pretty impressive as far as the life cycle of the tick and the bacteria go. Male and female ticks, when they start off as these little nymphs, as they hatch out of the egg, they technically are already infected. If the mother was infected, get to the right one. If the mother was infected, she will transmit that parasite, the bacterium, to her progeny, transovarial transmission. All of her eggs will be infected. All right. Another brilliant strategy to ramp up the population of that bacteria. So as the tick hatches out, there are multiple developmental stages within the ticks. They need to molt to get to the next stage. And in order for that to happen, they need a blood meal before they can molt to the next stage. So sharing that bacteria with others as they are doing this. All right. So the eggs are laid in the environment. They hatch out in the spring. And from that, our little larva, not our nymph, our larva, sorry, is our first one. And the larva, after about a month, is going to find a host, attach, take a blood meal, and then it will overwinter. All right. It only needs to feed once. All right. As this happens, truly for the parasite for the bacteria to be effective, our tick parasite needs to be attached to the host for a couple of days, feeding and allowing that bacteria to really get in there. All right. So 2 days. All right. We overwinter. We, in the process of that, we have developed and molted to the nymph stage. We feed on another mouse because these guys are little and it's easier for them to get onto these rodents before we think about the deer. All right. So they feed. Now we feed for a few days. We molt to the adult stage, male and female. They find a host, a deer. And as they are feeding, they mate, and in turn, the cycle continues. If they feed upon us, we're basically over here. Not that you can't be fed on by either of these guys, all right, but it's more likely that the adult tick is what's going to be feeding on you, all right? And same deal, it needs a couple of days of being attached. Oftentimes, if you are hiking around in an area where ticks are common, probably the first thing you do when you get back is check for ticks. You ought to, all right? And promptly removing them will help to ensure that you don't become infected with it. So they say a characteristic bullseye-shaped rash appears, but it's really only something that happens in a fraction of the individuals infected with Lyme disease. So that makes me wonder, should you really call it a characteristic? You definitely can see it, and this bullseye rash is indicative of that, but numerous people never develop that, and they still wind up with Lyme disease. So we can see the spirochete, Borrelia burgdorferi. Willy Burgdorfer was the individual studying all of this. Lyme disease, relapsing, all of these tick-borne illnesses. Really, Willie was the one studying that and all of the tick-borne illness. Pretty impressive, I think. So another one, relapsing fever. This is another Borrelia, and this causes a series, not the same as malaria with fever, chill sort of cycles, but kind of the same idea, where you get a few days of reprieve, you feel a little bit better, and then the fever comes back. So this just showing proper removal. There's all sorts of other ideas that you potentially should do, but you shouldn't. You want to carefully remove it, ensuring that the mouth parts aren't left in there. You don't want to try to squish it, kill it while it's still feeding, because those instances now you have probably inoculated all sorts of other stuff into your body along with that bacteria, and the potential for other issues besides some of these bacteria is present. So all sorts of bacterial infections with this anaplasmosis, anaplasma phagocytophilium, fever and flu-like symptoms, zoonotic transmission, brucellosis. This is often something we may think about with cattle or big game animals, melientus, abortus, canis, and suis. So undulating fever, flu-like symptoms, we think about contact with livestock or infected animals. That sets the stage for that. Cat scratch disease is Bartonella hensleyi. I think it maybe used to be Pasteurella, but that matters not. So a scratch or a bite from a cat, as cat scratch disease implies, sets the stage for swelling of your lymph nodes, pain and fever, fatigue, all sorts of problems. Ehrlichiosis, Ehrlichia chafiensis, more flu and fever situations with it. This one is transmitted by a different type of tick. These Lone Star ticks are more common in the southern portion of the United States. Lone Star makes me think Texas, but they call, and it's there. But it's a Lone Star tick because on the back of the tick is something little shape that looks sort of like a star. All right, Lone Star tick. These guys can transmit a handful of things besides Ehrlichia. But one fun fact, one little tidbit that I will share with you, being fed upon by the Lone Star tick is something that it creates in you. I call it the instant vegetarian maker. All right. It inoculates you with, I'm assuming, different proteins in the saliva that sensitizes you and makes you allergic to meat. All sorts of different types of meat. From what I have read, everything except for primate. So you're not allergic to your own meat, right? And many of us aren't thinking, dang it, I want a steak. I'm going to have to eat some monkey, right? Probably not happening, right? Or Jeffrey Dahmer it, whatever, right? Probably not, all right? I've had a couple of students actually, that have given me some tidbits. One student's mother contracted this. She was in Arkansas. Steaks, beef, pork, all of that stuff, bad news. I believe chicken was okay. So maybe not everything. All right. I don't know. All right. Stories make it I'm like, I'm not sure. I have heard against everything, but I don't know. I think so. I think so. And I don't know how bad it is, but I think it's pretty bad. She didn't realize that was what was up. She wasn't vegetarian. And then she would eat some stuff and get super sick and was like, what's going on? And then come to find out that's truly what it was. So as far as I know, you can't like allergy stuff, you can desensitize maybe and have, I don't think it happens. And I think probably from the ill effects you're getting, you're not thinking maybe just a little bite just to desensitize. I don't think that happens. So crazy. Pretty cool. Not if you're a carnivore. All right. Endocarditis and pericarditis is a handful of different organisms. Staph, strep, and enterococcus all have potentials for this. We have talked a little bit about some of this already with some of the other issues, skin infections and other things with these getting in. So Getting into the bloodstream, it can get in there through contaminated catheters, dental procedures may set the stage, and in some instances, if you are more potentially susceptible to some of this, you may be treated with antibiotics prior to having some dental work done. Piercing and wounds can also do this. All right, the epidemic typhus, Rickettsia prawazacii. These utilize lice as the vector. So fever, aches, potential fatal damage to the heart and brain as a result of epidemic. I want to bump down here to endemic. This is marine typhus, and this uses fleas as the vector. All right. Uh, this one's a little more mild, I guess maybe a little better to get compared to the two. Low-grade fever, headache, cough, some rash, another rickettsia organism that's transmitting it. So more mild. We saw the Clostridium and issues as a result of that. Infectious arthritis, our Staph aureus and Neisseria gonorrhoeae both can be culprits for causing septic arthritis, joint pain and swelling, impacting motion. So this bacteria, either of these bacteria have the opportunity to make their way into the circulatory system and get into the joints, causing these issues. So problems. I already spouted off enough stuff with that. Osteomyelitis, staph, and strep pyogenes. There are some others, but these are the main culprits. Impacting the bone, inflammation of bone tissue, which to me seems like that's got to be super painful, right? You would think. Fever, pain, edema, ulcers, and ultimately potential bone loss as a result of that. So the bacteria get in through wounds, some sort of traumatic event has the opportunity to get them in. Joint replacement may potentially do that as well. And there are other opportunities where we see a different infection, different body site, and a septicemic event where they get into the circulation and wind up causing that damage. Multiple possibilities. So as I said, with plague, multiple types of manifestations with that. The puerperal sepsis, this is the childbed fever that we thank Ignaz Semmelweis for teaching us all we ought to wash our stinking hands, right? So fever, shock, and death are main potentials with that. Rat bite fever, not to be confused with cat scratch, right? Streptobacillus monolithiformis and Spirillum minor are two of the bacteria that may be transmitted from that rat to us. So not only the bite, but exposure to feces, urine, contaminated food and water as a result of rats being on there has the potential to bring it to us. That's disturbing. All right, relapsing, we looked at. Rheumatic fever is another pyogenes, and this is, we talked about before, those immune complexes that have been generated that link up in different areas of the body, joints, heart valves, wherever, and then complement tries to do its job. I'm going to skip spotted fever. Toxic shock syndrome. Staphylococcus aureus is our culprit for toxic shock. High fever, vomiting, diarrhea, hypotension, so low blood pressure, and ultimately lending to death. The Staphylococcus may be from some localized infection that spreads into the bloodstream, septicemia. There are other opportunities. Tampons or intravaginal products have the potential to cause this as well. Staph aureus on the skin, and then potentially being deposited or inoculated into an area rich with nutrients. So I don't know when this was, 1960s or 1970s. There was a brand of tampons, newly released, marketed as some great product. I don't claim to know all sorts of details about feminine hygiene products, thankfully. But these products were touted as something you could apply and leave in for 24 hours. That's a long time, I feel like, to keep that in. All right. And the issue was recognized when some Staph aureus was inoculated in, and the bacteria were able to proliferate, releasing toxins and setting the stage for these issues. All right. Those they do not recommend that anymore. And there are warning labels on the packaging of these products that recommend that you do not leave them in for prolonged periods of time, like 24 hours. Bad news. All right. And that's truly why. All right. And numerous women died from toxic shock syndrome as a result of that. All right. Crazy. This one is different but similar. This is toxic shock like, and this is pyogenes. So another high fever, sudden high fever, vomiting, diarrhea, potentially ARDS or acute respiratory distress, hypoxemia, so you're not getting adequate oxygen, necrotizing fasciitis, all sorts of bad news, and then death. This is another sequelae of the strep infection or soft tissue infection. Trench fever, Bartonella quintata, more high fever, conjunctivitis, eye pain, headache, pain in the bones, shins, neck, and back as a result of this. And lice serving as a vector for transmitting Bartonella. And we already saw tularemia. So eating it poorly cooked, all right, and handling infected rabbits have the potential. There are other opportunities for that as well. All right, some viral stuff. The Burkitt lymphoma, large tumors. Epstein-Barr virus is the culprit for that. It's also the bacteria that causes infectious mononucleosis, and that's another possibility with that. Mono is the first, and then the potential for the lymphoma is after. This cytomegalovirus, and here we can see a cell infected with that. This is the nucleus of that cell compared to one that's uninfected, giving it the owl-eye appearance. Great big, well, cell and nuclei distorted. Ebola just terrifies me. I don't even want to talk about it. So much stuff. This is a viral hemorrhagic fever, something that super deadly, although some individuals do have opportunities to recover. Many do not. There are numerous accounts of that, like Hot Zone describing some of that pretty accurately. All right, here we can see an image of HIV in green budding off of a T cell, the big blue blob in the periphery. That's what we're visualizing here is the cell has been infected. They've went through the viral cycle, replicated, and now budding out of there. All right. So this just showing global prevalence of HIV. I'm pretty sure there is a little bit of detail in there, maybe case study. I can't remember what it is in the text going through some of this. But this 2015 showing worldwide distribution and the levels. What I want to point out are super high levels in some parts of Africa where we see the highest levels and we see the least amount of effort put in for education about it, prevention mechanisms. There are all sorts of details with that that are super disturbing, and, you know, potentials for uh, societal problems where we need to transition away, like practicing safe sex, having condoms at the ready. They're like, well, that just means you're going to be promiscuous. How can I trust you? Right. Or all sorts of other things like that, that set the stage for it to be readily transmitted. And also numerous governments that won't accept that HIV causes AIDS, so they do nothing about it. Ignorance is bliss. No, it's not, right? Uh, so with that, this cycle of HIV to AIDS, I think is pretty impressive. We can see in blue are T cells, and in red, the HIV virions, and a course of time from weeks, and our little jig-jagging here, pushing it over into years as we look at the latter half of what's going on. So after coming in contact with the virus a few weeks, kind of like bacteria with that lag phase, takes a little bit of time, all right? And then we can see detectable levels of the HIV. We see their levels spiking a few weeks, month and a half-ish after infection. You see a spike with the HIV. You see the level of T cells declining as HIV is increasing. Those cells are getting depleted as the virus is replicating, destroying, and infecting more of them. As HIV peaks, we see a big dip in the T cell population, and then we see HIV dipping as well, as it sort of seems as if maybe the immune response is effective, but it's truly not. All right. So the level declines and our T cell level comes back up a little bit. It never goes back to normal. All right. So we get a little bit of time, potentially a few years, maybe a handful of years. And in the course of that time, T cell levels still are being depleted. HIV levels are slowly coming up. And we hit a crisscross right here, potentially a point of no return, where the level of HIV surpasses the T cell population, and we see where symptoms truly start to appear, maybe closer to this. All right. At this point, in between this, we call the latency. All right. You feel pretty good. All right. Don't really recognize serious issues. And after this crisscross, this is where we see the constitutional symptoms. This is where we would say you have transitioned from HIV to AIDS. And now your immune system is basically incompetent and can't combat anything and everything that's thrown at you. There are numerous organisms that we talk about and have talked about where we say compromised situations, HIV or AIDS situations specifically, individuals are considerably more susceptible to that, or opportunistic situations where if you really are compromised like that, you got a greater likelihood. Other individuals probably never recognize some of these infectious agents as being infectious. Crazy. So long list of viral, but not as long as our bacterial ones. Chikungunya fever is another hemorrhagic, handfuls of these. Dengue fever, I think is pretty interesting. They call it break bone fever because the pain is so severe, you feel like your bones have broken. That is terrifying. So Ebola, hantavirus is something that kind of reared itself around here, really south, the Four Corners area. I think it was the 1990s, maybe, when there was an outbreak with this, and kind of getting on the radar. Rodents, mice and rats potentially harboring it and coming in contact with urine or feces potentially sets the stage for that. Oh, malaria. So much good stuff with this. The mosquito transmits it. It gets into us. We have already talked the littlest bit about malaria. I could talk a whole hour about it. They migrate to the liver. They get out of the liver and infect red cells, replicating asexually. Some of those rounds of replication generate the gametocytes, the reproductive portion of these parasites, male and female cells. They get sucked up by a mosquito. They undergo sexual recombination in the gut of the mosquito, fertilization, creating this zygote. It goes through asexual replications, creating sporozoites that are in the saliva of the mosquito that get inoculated back into us, and the cycle is complete. All right. Massive red cell destruction potentially depends on the specific type of malaria. Plasmodium falciparum is the most common type of malaria, and it is the most dangerous. Over 50% of malarial infections are the result of falciparum. If you are infected with this parasite, it gets into any aged red blood cell. Others have some preferences. Falciparum doesn't care. And as it does that, the potential for numerous red cells, 65% of your red cells could be infected and lysing simultaneously. If you don't think that's going to kill you, you're sorely mistaken. 25% or so lysis of your red cells is typically a fatal consequence. That's bad news. If you are not treated, you're gonna die, right? Awesome. Terrible. Cat lovers, Toxoplasma gondii. I love this. We're hearing all sorts of things about this parasite currently that I think is pretty fascinating. The potential for some central nervous system involvement in us is a possibility. Schizophrenia, maybe, maybe the culprit. They think other things like maybe some thrill-seeking behavior. If you like, bungee jumping or skydiving or something like that, maybe. All right. I read something that's like, oh, somebody that likes eating hot peppers, spicy stuff. I'm like, I hope not, right? Is that what you're telling me? I hope not. All right. Litter box is typically what we think of as a main way for us to become infected. Those oocytes, the baby plasmodium, can get inhaled and cause infection. Truly, the issue with this are females, childbearing age, especially if a bun is in the oven. The potential for the parasite to infect the fetus, it's almost a given, all right? That's disturbing, but it has to be inhalation of this getting into your system while you are pregnant that the infection happens. All right. About 3,000 births per year in the United States exhibit toxoplasmosis. There's a few million births a year. So it's a fraction of that, but still concerns. Most litter has warning labels on it telling women to use caution, especially if they are pregnant when they're changing the litter box. We can get it other ways. Poorly cooked meat where the cysts are in the musculature. It's been observed to be transmitted through blood transfusions from an infected individual. All sorts of details. Coming in contact with cats sets the stage, right? And with that, they kind of assume that as we make it to adulthood, the bulk of us, if we were to take a blood sample and test for antibodies against this parasite, virtually all of us would have antibodies against it. But we don't exhibit serious issues, all right? Typically, we don't. all right? But you never know, all right? Uh, there are some crazy stuff with parasites, and oftentimes parasites will do something to an intermediary host to make it more susceptible to that host. The cat is the definitive host. The parasite in a mouse gets up into the brain, causes the mouse to behave in ways that it truly shouldn't. Now it's got some thrill-seeking behavior. It's attracted to the cat. It's attracted to the odor of cat urine, wants to be close to the litter box. So when his buddy comes down, they can hang out. But the cat doesn't know that the mouse just wants to be friends. It eats it. All right. And there you go. When I learned about all of that, it made me stop and say, wait a minute. Tom and Jerry must have been infected with this parasite because he constantly pestered Tom. He loved Tom. He wanted to be his friend, right? Uh, that's why, right? Uh, old school Tom and Jerry, classic, all right? Uh, I think the new one, they really are friends. All right. So different forms with the parasite and the potential for it to insist in our musculature or in our brain. Definitely an opportunity with it. But like I said, uh, unless you're actually pregnant and get these parasites in, not a bad situation typically. All right. And hence why many of us have likely got antibodies against it, unless you've never ever come in contact with a cat. And who hasn't, right? Even if you hate them, right? Babesia, this is another parasite transmitted through ticks. Babesia microti is the one that gets us. There are a handful of other ones. And you can see the parasite inside of the red cells, different looking than malaria, but still inside of these cells replicating, causing issues. Trypanosoma cruzi, one of my favorites. This is a flagellate, call them hemoflagellates. They don't live in the cells, they live alongside of them, all right? Many of these flagellates are transmitted by the saliva of a bug. These guys are transmitted through the feces of the bug. We call it the kissing bug or the cone nose beetle. It is not an assassin bug. All right. Assassin bugs and the triatomine bug are close cousins, but they're not the same. All right. The bite of these guys is painless. You don't recognize it. They feed on you typically at night, nocturnal, attracted to carbon dioxide. So they crawl up on your face, take a blood meal, and potentially the feces gets into the wound, gets brushed into your mouth, rubbed up into your eye. Mucous membranes are where it needs to go or into the wound. And then the infection results, all right? The assassin bug, its job, it's a predator. It kills other bugs. And if it bites you, you know it bit you. It is super painful, all right? All right? But they do look very similar. The assassin bugs, I believe, are around here now. They are making their way northward as we see climate shifting. I'm pretty sure our kissing bug is marching behind. All right. We see these in southern portions of the US, desert regions, Mexico, Central America, definitely. But southern states, Texas, Arizona, New Mexico, southern parts of Utah are seeing it now, and marching north. All right. Disturbing. Chagas disease is the result of that. Leishmania, there are handfuls of types of Leishmania, cutaneous, visceral, and numerous species that can cause this. Leishmania mexicana in Central America, Mexico, potentially moving up a little bit into areas like southern Texas for opportunities to see some of this. There have been other instances different, not Mexicana, for some Leishmania to show up kind of Gulf states last summer I heard a little bit about some of this. So many. And a helminth, not shown. We should have. I should have a picture of that for you. Schistosomiasis. This is a helminth. This is a type of fluke. These flukes are different than the others because they are dioecious, separate sexes. All of the other flukes are hermaphroditic or monoecious. They pair up in the vasculature, they mate, they release eggs that are released either in the urine or the feces, and have the potential to cause some serious issues. They can live in our vasculature for a couple of decades, possibly. Some have opportunities, those living in the bladder plexus, as those eggs are deposited into the bladder, causes all sorts of damage and potential bladder cancer as a result. Crazy. All right, I will stop with that. That's all I got for you. Thank you very much for everything. Have a good break soon. Good luck on all your finals. This final set to open in 10 minutes. Next Wednesday. Next Wednesday, 5 p.m. Next Wednesday is the day that this is really supposed to happen. So you got ample time.
And 100% lowest test gets dropped.
Yep, lowest test gets dropped. This final, yeah, the final that opens today. If you take it or if you don't take it, done deal.
It's like the NFL draft. I'm taking for Caleb Williams.
Okay, there you go.
Thank you.
This is my favorite.
Perfect. Thank you.
You want me to email it to you?
Nope,
Okay.
no, because now I got it.
Okay, perfect.
Thank you very
Thank you
much.
so much
All right.
for having us.
Yep, no problem.
Thank you.
Thank you. Have a good one.